My name is Mathew Bewley. I'm the owner and managing director of 3B Training. And with it being World Mental Health Day, we decided to do a webinar around, we're doing lots of things, but one of the things we wanted to do was a webinar based around a talk that I've done on a few occasions now. We are recording the session. We will be sending out the recording and the presentation at some point after. There is a Q&A session at the end, so if anybody does have any questions, there's a Q&A box at the top of your screen on Teams. Feel free to drop a question into there, and then we will go through and answer some of those at the end, as long as we've got time. So who am I to talk about mental health? Well, like I said, I'm the managing director and founder of 3B Training. We're a health and safety training company and business, mainly operate in the construction and manufacturing sector. Personally, I've worked mainly within the construction sector since I was around 18. As you can see on the screen, this is my family. So I'm a family man. Got a daughter, wife, and 2 Cocker Spaniels. I'm what I consider a very lucky man. But why this subject is important to me, and why I'm so passionate about it, is pretty much I have always suffered from some sort of anxiety, which then at times through my life has led to depression. Pretty much suffered my entire adult life, but certainly in my late teens, early 20s, I didn't really understand what it was. It wasn't something that I was talked about, and it wasn't until probably my late 20s that I was diagnosed and really started to come to terms and understand what it was that I was suffering with. Which then allowed me to talk a little bit more about it. It's obviously why I find this topic so important. And really what I wanted to do is use my experience of how I support others. And this is just one of them. And the 7 tips that I wanted to talk about today is one of those things that I think I've been able to do to support others that I wanted to share with everybody. And I think that's so important. Because even though I suffer with anxiety and I've had depression in the past, it hasn't stopped me living a full and fulfilling life. So before I start, I just wanted to think about a couple of things, particularly at work. And maybe sort of as I'm going through the 7 tips, asking yourself, does my company, and the first question I'd really like you to ask yourselves is, does my company take mental health seriously? The second question then I want you to think about is, have they formally appointed mental health first aiders? And does everybody know who they are and how to access them and to use them? And then the last question I've got that I'd really like you to think about is, as an organisation, do they have a strategy, or do you have a strategy to really support those mental health first aiders and overall to really improve the company's mental health culture? So with that in mind, I'd like then for us to start thinking about the 7 tips and the things that I didn't come up with these on my own, so this isn't a case of all my own work, but this is something that I introduced to 3B with our senior leadership team. And these are the tips that we try and live to today to make sure that we have a culture that we're proud of when it comes to mental health. So tip 1 is about deciding the type of culture, the mental health culture you want within your organisation. So before I worked at 3B, I was involved in a business where, for me personally, I felt it had a poor culture. Now, that wasn't because particularly of the business owners or the senior leadership team. I actually became part of that senior leadership team, but it was, it really boiled down to we didn't have a direction when it came to mental health and culture. It wasn't even something that was often really discussed. So we didn't have a strategy. So the culture was often decided by some of the more negative people in the business, which then really drove the whole mental health culture of that business. Now, luckily enough, I moved on and went to work elsewhere and founded 3B. And what I wanted was a very different culture to the way I had experienced before. And I wanted to make sure, as a business, 3B could really support anybody who might have had negative feelings or, maybe wasn't feeling so great. And really be able to sort of feel in a safe place where they could open up about those sorts of things. And what we started to do is think about core values, which really, from my point of view, run right the way through all our culture. And the one thing I want everybody to be able to feel and do and be is be honest, be your best, and be smarter. And they're our core values. But this tip is really about thinking and deciding the type of culture that you want when it comes to mental health within your business. So tip 2, culture is a massive thing, and whether you're starting out or changing a culture or even looking to improve a good culture, that's a huge undertaking. So tip 2 is about getting the right people surrounding you, and every organization has managers and senior leaders, and it's important that you get the right people and get those key people bought into the idea that you're trying to come up with and the things that you're looking to do. So this for me is about surrounding yourself with key people, that are going to help you develop your mental health strategy and the culture that you want to ultimately your business to adopt. Make sure that you've got ideally an owner and directors involved. I don't think that's a must, but it will certainly help. There's going to be some tough decisions and possibly even some changes needed. So I would always look to try and visualize those changes, and the impact that they could have on the business and try and paint a picture. It's often much easier to try and develop a culture around pictures and key words than lots and lots of text and complicated policies. But if you've got something simple that the message that you give as a steering group or senior leaders will really help you in driving that and keeping everybody in track. And the key things that I felt were needed here was when I wanted to start out and have some core values, the be honest, the be your best and be smarter. They weren't just my ideas. I got lots of people involved in coming up with those. And we've had those now for over 10 years and they still stand the test of time. Every time we come to review them and do things like a senior leadership training day, we always look at our core values and think, are they still relevant today? And they are. And it's because of the type of culture and the mental health culture that we're trying to promote. We often then look to do team building events. Now, I'm not talking about big extravagant events here. It could be taking a small team for a coffee. That might, be a Starbucks or a Costa, but it could quite easily be in your own canteen. It might be going, organising walks at the end of work. It might be bike rides. It can be anything you want. But and again, it doesn't have to cost lots of money, but by bringing the key team together where you're trying to develop a culture, what you'll find is you'll all start to then, get the ideas that you want. You'll bring that together and be able to develop that when you're really looking to implement this within the business. I think the last thing that I did here, I was very open and honest and shared a lot of my personal story. So my senior leaders and managers felt comfortable when they might not have been feeling at their best and really decided that they wanted support. And it works both ways. I got support from that leadership team, but it also meant when they had had issues and they wanted to discuss them, and that was affecting their mental health, they then felt more comfortable speaking to me about it. So tip 2 is all about getting the buy-in you need from your senior leaders, and really making a plan of what you're planning to do. Tip 3, and I think is probably one of the key tips out of this. Once you've done that and you've got an idea and a bit of a plan in terms of how you're going to improve or change your mental health culture in the business, it's really about engaging the wider workforce. And I'd really stress here, really don't force it. It will take time, any change, for people to adopt and become comfortable takes time. So it's about little steps, moving forward a bit at a time, so you're moving in the right direction. The age-old saying, Rome wasn't built in a day. You've got to sort of take this. If you force it and you're trying to push it onto people, they will naturally sort of maybe rebel a little bit or certainly back off. I think it's really important that you get people's ideas, you get feelings, and you get people to be honest with you. And you might hear some things that, aren't great, but it's really important that you create a safe place for the wider workforce to be able to engage. And I think it's really important that you don't judge. If someone feels a certain way and that's then affecting them within work, it's working with that group and that people to really make a change and move it in the right direction. Try and engage and get the wider workforce involved in steering groups. So again, going back to holding events and support, charitable events. So, again, it wasn't a 3B event, but recently a couple of colleagues got together and decided they wanted to do a walk up Snowdon. They ran it, they organised it, but we 3B gave them all the support and help, and in the end there was sort of 15 to 20 of 3B employees and their partners walking up Snowdon. That event alone, by 3B offering the support and helping where we can, it creates that culture where people then can really sort of share their stories. Just, the amount of stories that were, would have been told on that journey up and down Snowdon, really helps create positive noise. And I think that's really important. You're giving people, a space to operate, to think, to talk. And when you create positive noise, that really gives you a snowball effect. And once that gets started, the culture starts to then develop and will look after itself. So tip 3 is about the engagement of your workforce. So tip 4, for me, this is all about training, communication and follow-ups. Okay, so yes, as part of your culture, you might need to deliver some training. And listen, I'm going to say it, I know a pretty good company that can help you as well. But all seriousness, it needs to be appropriate. It needs to be planned out. And the one thing I would really like to say is it doesn't have to be expensive. You don't have to bring people in, consultants and things like that, to really start developing a mental health culture. It's far better if it's done naturally, internally, by the people who are involved in the business. There's things that you might have to think about if you've not done it already, but it's training. So you've got a number of people who are mental health first aiders. What I often see, though, is companies and organisations do that, but then what they don't do is train the wider business on why you have mental health first aiders, how to use them. And again, that doesn't have to be a formal, expensive course. It can be done through Loom videos. It can be done on team meetings. It can be part of a company update. But it's really important, if you're going to have a mental health culture, you need to make sure that your mental health first aiders are properly trained and know where to go and what to do in the event that they are speaking to someone who is having issues and really wants to talk about their mental health. And it's really important that the wider workforce know what the mental health aiders are there for and how to access them. Going back to my previous point, make sure that, you are encouraging staff, to do things outside of work. So learning new skills often helps. Making sure that you're developing, that culture where, you might deliver some training, might not necessarily be a huge benefit to your organization, but if it's a benefit to people's mental health and improving the mental health, then it definitely will be. So tip 4 is all about sort of that training, that communication, and that follow-up. It's making sure that people are engaged and involved with what's going on in the workplace when it comes to your mental health culture. So here I wanted to just share a little bit of my story and how I came about and what sort of changed in my life and why I'd started to think about that certainly this sort of 7 tips that we've got today at 3B. So this is Alfie. He's a Springer Spaniel. God bless him. He's not with us anymore. But at my lowest point, I was having lots and lots of negative thoughts. I was feeling very unsure about myself, which then, eventually led to, some quite serious suicidal thoughts. And from my point of view, I was in a really, really bad place. I didn't want to talk, didn't want to open up, and I really didn't know where to turn and what to do. But I'd had Alfie, probably coming on 6 months. And I'd grown up with dogs all my life. We'd had a couple of Springer Spaniels in the past when I was younger, and I really found a connection with him at this time and this low point in my life. And at this time, my wife was really struggling to help me. My family were really struggling to help me. But through this connection, my wife really encouraged to try and improve that connection I had. So she arranged for me, and obviously we took Alfie along to go on some coaching sessions to become a dog trainer. And quite quickly I realised actually I wanted to be able to really communicate with Alfie and get him to do the things that you want every dog to do: sit, give you a paw, lie down, roll over, come back to you when you ask. And again, what I didn't realise through that process, something that I'd never even really considered in my life, considering I'd grown up with dogs all my life, I gradually came out of that period of my life to being in a much more positive place. And for me, this was all about tip 4. It was about looking for things that, you can really help people with. And all all my wife did was encourage me to do something that was positive, created positive noise around something that then really helped me. And it was the communication I got at the time, it was the training and development, and again, it was something that I was encouraged to do that was positive. And through that process of those Saturday mornings that I went, honestly, wind, rain and shine, my moods changed fairly quickly, and I genuinely believe, had that not happened, I might not be here today. And Alfie, without a doubt, saved my life. So back to the tips. So tip 5 is all about promoting open and honest discussion. Now, conversation is always about 2 people, and it takes 2 to have a good conversation. When you're talking to somebody though, and they're sharing, sometimes we all have a couple of these, and sometimes it's a case of, and I'm guilty of this. Someone will start sharing and I start talking, and once I get going, I don't shut up. But you really do have to listen and really listen to what people are saying. There will be times where it's appropriate for you to open up and give your story, and I think that then will help people feel comfortable to do that. But sometimes the best course of a conversation for somebody who really wants to share how they're feeling is to just that feeling that they can shoulder some of that on somebody else. And honestly, that can be a lifesaver at times. And people should be made to feel that it's quite okay, it's normal, and that when they're sharing how they're feeling, that they won't be judged. So to do that, I think there's some key things that we all need. first and foremost, we need a safe place. So we need to be able to create a safe place for people to open up and talk. So lots of businesses now, open plan offices, or if you're in an office, you've got more than one person. So you need to make sure that wherever you are as an organization, you've got somewhere that, that person feels safe, and if they want to make it confidential, it can be. I think when it comes to your mental health first aiders, and especially if they then are the ones that are going to be leading on some of this and helping with the culture and speaking to people, they are volunteers. I know so many people who are mental health first aiders, and we deliver that course. And when you ask them, they were told to go on the course because they thought it was appropriate for the role. It's got to be, for me, and in my opinion, a position that you volunteer for. And I think that's really important. And going back to, when you're looking for mental health first aiders, you want to make sure that, if they've got a day-to-day job, that they can cope with then taking this extra burden on, really making sure that they can do that. So tip 5 is about promoting open and honest discussion within your workforce and making sure that your mental health first aiders, are volunteering for the position and have got the capacity to really do this and take this on and really help you with developing and promoting positive culture within an organization. Tip 6, and quite rightly so, really important, it's about looking after yourself and your mental health first aiders. We all have mental health, and so do our mental health first aid trainers, people who are there, to help you. So our mental health first aiders, just because they might have been on a course, doesn't give them a badge to basically say, I'm okay now, I don't suffer from mental health, because I guarantee some of them, will, if not all of them. So I think there's a few key things as a team that you need to do. Meet up as a team, make sure that you're checking in on one another, make sure that they can really, do the day-to-day duties alongside anything that they're being asked to when when you're asking them to do sort of the mental health duties. And somebody said to me a long time ago, and I really like this analogy, but an empty cup can't fill another cup. So self-care is really important, and I employ, people lead by example with this, especially if you're leading on a project like, developing a mental health culture. So tip 6 is about looking after yourself and mental health first aiders. And then the last tip is about, it's about this is just the beginning. Okay. So tip 7 is all about mental health never stops. And if you don't, if you implement this and then forget about it, you potentially can make things worse, especially if it's not planned out. And if things don't work quite the way you expected the first time, you've got to go back then and tweak and change, make improvements. There's going to be times where you'll want to review policies and procedures. There's lots of things out there that, other organizations are doing, around mental health and things. And you know what? Sometimes just inviting someone for a chat, a coffee, and a piece of cake, is really important. And it's a Swedish term, fika, F-I-K-A, and it's basically a term that they have where we don't have it in this country, but it's basically come for a chat, let's have a coffee and a piece of cake. If you research FICA, we should all be doing more of this, and it's all about speaking to people who you might not necessarily speak to all the time, or if you're at the brew station and you're making a coffee and someone's there, just having a chat, being the first person just to say, what are you up to today, what's it going, and opening up. So it's about the beginning and keeping the process going of your culture, because it will never stop. So for me, that's the summary, and the 7 tips. Like I said, we will be sending this out, moving this on, so you've got it. And we constantly look at this within 3B, and I constantly look at this to make sure that, we adopt this and move forward. So that's the end of the 7 tips. So, thank you and thanks for joining me and my colleagues. Obviously, my contact details are on there, so feel free to take those. Please leave a review. So there's a couple of QR codes on the screen, so you'll be able to leave a review on Trustpilot, and then there's also a QR code to the blog that is based around the 7 tips. But if anybody's got any questions, more than happy to answer them. I know we're coming close to the 30 minutes, but I'm more than happy to stay on for a few more minutes yet.
We've got one question that's come in, Matt, if you want me to read that out
yeah,
now.
if you want to read that out, Georgia, yeah, no problem at all.
Yeah, it's from Sarah, and the question is there an advised number of mental health first aiders within a business based on size?
This is difficult because I'm going to come off mental health research then, but we're the HSE published some guidance on first aid. So if it's physical first aid, then there is some guidance there. Now, I'm not saying you could use that as a rule of thumb. But this is difficult because I think a lot of it comes down to the culture you've got, how those people are spread across the business. Are you all based in one location? Are you could have 20 people in your location, but you're in 4 different locations. And I would argue you would then probably want at least one, person in each of those locations. But if you've got 20 people all in one location, you might decide you only need 2. So it's without knowing the details, Sarah, it's a bit difficult to answer. The one thing I would say, though, is, and I see a lot of organisations doing this, they might be a relatively small organisation, or they might have, lots of people, but in offices, in small numbers in lots of offices. And I think what often happens is they only train one mental health first aider. I would argue you always need a minimum of 2, possibly 3. The advantage to that is then you've got a core, so you can then move that mental health workload. That will sometimes you will find that there's lots of people that want to talk to you. There'll be good times, there'll be nobody. But I also think it's really important that you've got a group, you've got a strategy, you've got a culture that you're looking to develop, and it doesn't all shoulder on one person. So certainly any organisation should have a minimum of 2. If you can afford to put a 3rd person on it and create that group, what you're going to start creating a really nice dynamic. But I appreciate that's not always easy, and it's difficult depending on how your organisation is set up and the logistics of that. So I hope that helps. But if you wanted to speak more specifically about your organisation, I'd be more than happy to give you a few ideas. Feel free to drop us a line.
We've got one last question that's come in as well, Matt, from Mike, and that is, what does good look like in terms of psychological safety?
Wow, okay, what a question. I would always say probably good isn't good enough. I think you should always be looking to improve. It's difficult because when you're talking about psychological safety, that's not a term that everybody will necessarily understand and feel that they know what to do with. So from my point of view, I think it's really key that when you're setting out around things like psychological safety, first and foremost, everybody knows what it is and what it means, and that you then, you demonstrate what good looks like within your organisation. And I think, particularly in our culture, I think sometimes we can be, a little bit negative. We're always the first, sometimes, when things go wrong, to point that out. And again, when we're talking around mental health, for a long time, the stigma was always it's negative. If I talk about suicide, for a long time, it was always a very negative thing, and the culture around it and the stigma around it was always very negative. And we need to get people to open up much more about it. I'm not saying obviously it's talk more positively about it, because there's a tragic element to it. But if we make it safer for people to start talking about and using terms like suicide far more, what we're going to find, people will talk more about it. They will open up more about it. And we need to really deal with this stigma around mental health and suicide, because for people to open up and talk, they need to feel safe. And if they don't feel safe, they won't do it. So it's a great question, but it's difficult. But I think the first and foremost is looking at people, the stigma, the words that we use, and making people feel comfortable that, do you know what? If I'm feeling suicidal, they can seek somebody out and go and talk about it and why they feel suicidal, and all the different terminology. I feel depressed. So, okay, great. Step you've made now to tell someone about it is a real positive, and we shouldn't think that is a negative anymore. And I think so many of us do. I hope that has answered your question. But again, if it hasn't, feel free to reach out, and I'll be more than happy to talk to you in more detail about it.
That's all the questions that we've got for today, Matt.
Well, look, lastly, just want to thank everybody. Really appreciate you joining us today. I really enjoy talking about mental health because I really believe if I just help one person, then it's all been worthwhile. So, I hope you all have a great day. And hope to see you on another webinar soon. Thank you very much.